Necrosis is a type of cell death characterized by the premature and uncontrolled death of cells or tissues in a living organism. It occurs due to various factors that disrupt normal cellular processes and can lead to severe consequences if not properly managed. Here's an overview of necrosis, its causes, types, related diseases, symptoms, and potential treatments. Definition: necrosis is the death of cells or tissues that occurs as a result of external injury, infection, lack of blood supply, ischemia, or exposure to toxins. Unlike apoptosis, which is a programmed and controlled form of cell death, necrosis is a pathological process that leads to the release of cell contents and inflammation. Causes of necrosis. There are several factors that can lead to necrosis, including a. Physical injury, trauma, burns, frostbite, etc. b. Ischemia, insufficient blood flow to tissues, leading to oxygen and nutrient deprivation. c. Infection. Pathogenic microorganisms can cause tissue damage and cell death. d. Toxins. Exposure to certain chemicals or substances can trigger necrosis. e. Inflammation. Chronic inflammation can contribute to necrosis in affected tissues. Types of necrosis and their definitions. a. Coagulative necrosis. This is the most common type of necrosis. The affected tissue retains its basic structure for a while but loses its nucleus and cytoplasm. It often occurs due to ischemia and is typically seen in organs like the heart, kidney, and liver. b. Liquefactive necrosis. This type of necrosis is characterized by the rapid dissolution of dead cells, creating a liquid-filled cavity. It is commonly associated with bacterial infections, especially in the brain. c. Caseous necrosis. This form of necrosis results in a cheesy appearance of the affected tissue, commonly seen in tuberculosis infections. d. Fat necrosis. Usually occurs in adipose, fat, tissue due to the release of activated lipases, leading to the breakdown of fats and the formation of chalky, white areas. e. Gangrenous necrosis. This type of necrosis is typically seen in extremities like fingers, toes, or limbs and results from a combination of coagulative and liquefactive necrosis. It often occurs due to reduced blood supply and is associated with severe infections. Related diseases with necrosis and their causes, symptoms, and treatment. a. Myocardial infarction, heart attack. Cause: blockage of blood flow to the heart muscle due to a blood clot in the coronary arteries. Symptoms: chest pain, shortness of breath, nausea, sweating, and pain radiating to the arm or jaw. Treatment: immediate medical intervention, such as thrombolytic therapy or angioplasty, to restore blood flow and limit tissue damage. Cause: interruption of blood flow to the brain, either due to a clot, ischemic stroke, or a burst blood vessel, hemorrhagic stroke. Symptoms: sudden weakness, numbness, confusion, trouble speaking, severe headache, and loss of balance. Treatment: quick medical attention is essential to minimize brain damage. Treatment may include clot-dissolving medications or surgery, depending on the type of stroke. Cause: reduced blood flow, often due to peripheral arterial disease or severe infection. Symptoms: tissue discoloration, foul odor, pain, and the formation of sores or ulcers. Treatment: surgical removal of dead tissue, debridement, antibiotics to control infection, and addressing the underlying cause, which may involve vascular procedures. Cause: inflammation of the pancreas, often triggered by gallstones or excessive alcohol consumption. Symptoms: severe abdominal pain, nausea, vomiting, and fever. Treatment: supportive care, pain management, and addressing the underlying cause. In severe cases, hospitalization may be required.